So today I'm here to talk to you about two very well-known herbs that you probably already have in your kitchen and or supplement cabinet right now. And that is ginger and turmeric. So ginger and turmeric, these are things you may not have heard about before in regards to these two particular herbs. And the research is probably stuff that's difficult for you to actually identify when you look up blogs and articles that talk about the health benefits. So first of all, ginger as it relates to nausea. Ginger actually has a powerful anti-nausea effect. This systematic review and meta-analysis of 5 randomized controlled trials of 363 patients found that at least 1 gram of ginger significantly reduced the risk of post-operative nausea and vomiting compared to placebo, with a relative risk of 0.69 and minimal reported side effects, meaning it reduced the likelihood by 31%. It was also shown to be as effective at reducing nausea compared to a comparison medication. There is also some evidence to suggest it may increase gastric emptying, and evidence ginger in isolation and with other compounds helps with indigestion or dyspepsia. A randomized 4-week trial on patients with functional dyspepsia showed that daily consumption of Protogest before lunch and dinner resulted in a significant amelioration of functional dyspepsia symptoms, including nausea, epigastric fullness, epigastric pain, and bloating as compared with placebo. Now, ginger also has a very potent anti-inflammatory and muscle soreness relief properties. So specifically, ginger can actually help to reduce muscle soreness and also have a very powerful anti-inflammatory action. A study on reduced muscle soreness found that 6 weeks of daily ginger or cinnamon supplementation of 3 grams reduced muscle soreness in female taekwondo athletes without significantly affecting interleukin-6 levels, suggesting no major impact on inflammation. While some may worry that ginger's anti-inflammatory properties could blunt post-exercise muscle growth, this study indicates that it does not impair the inflammatory response necessary for muscle adaptation. Anti-inflammatory effects. This meta-analysis of 16 randomized controlled trials for 1,010 participants found that ginger supplementation significantly reduced circulating levels of C-reactive protein, high-sensitivity C-reactive protein, and tumor necrosis factor alpha, but had no significant effect on interleukin-6 or soluble intercellular adhesion molecule. Next up, we have the potential for ginger to counteract osteoarthritis. Now, this is not medical advice, but this meta-analysis of 5 randomized controlled trials, including 593 patients, found that oral ginger powder actually provided a modest but statistically significant reduction in pain and disability in osteoarthritis patients compared to placebo, though it has also increased the likelihood of treatment discontinuation due to adverse effects. This indicates that ginger may be useful in conjunction with regular therapies, but as always, consult with your doctor before changing your routine. Now, what about how ginger can support the cardiovascular system? This meta-analysis found that ginger supplementation significantly improved lipid profiles by reducing total triglycerides, cholesterol, LDL, and increasing HDL, while also decreasing BMI, with higher doses of greater than 1,500 milligram a day for more than 8 weeks being more effective for weight control. Interestingly, another meta-analysis found that ginger supplementation reduced total cholesterol and triglyceride levels, particularly in obese individuals, but had no beneficial effects on LDL and HDL. So while ginger may support cardiovascular health, you shouldn't rely on it solely for LDL and HDL. Now, what about the lesser known potential benefits of ginger? First is weak anti-cancer benefits. A reminder that this is not medical advice. This systematic review analyzed in vitro studies and randomized clinical trials, finding that ginger effectively induced apoptosis in cell culture models of colorectal cancer, but its impact in human trials was mixed, showing some increases in anti-cancer markers, but generally weak efficacy in preventing or treating colorectal cancer. Second is lead toxicity. This study in lead toxicity-induced rats found that ginger extract significantly increased renal antioxidant enzyme levels, including glutathione, glutathione peroxidase, glutathione S-transferase, and catalase while also reducing histological kidney damage, suggesting a protective effect against lead-induced nephrotoxicity. And last is respiratory benefits. This randomized placebo-controlled trial in 32 mild to moderate uncontrolled asthmatics found that low-dose ginger, about 1 gram twice daily for 2 months, did not affect exhaled nitric oxide or blood eosinophils, but significantly improved 3 measures of asthma symptom control by day 28 and modulated asthma-associated cytokines, suggesting a potential therapeutic role for ginger in asthma management. Now, here's the first myth around ginger. Number 1 is blood sugar control. While you may see online that ginger has been associated with better blood sugar control, which is similar to cinnamon, a meta-analysis investigating just this found, despite convergent literature, there was no significant effect of ginger supplementation on fasting blood sugar or HbA1c. However, individual studies reported mixed results, with 2 studies showing a significant reduction in fasting blood sugar. This suggests that while ginger may have potential as an adjuvant therapy, its overall impact on glycemic control in type 2 diabetes mellitus is not statistically significant when results are pooled. Moving on, we have turmeric, also known as curcumin, specifically as it relates to anti-inflammatory and pain-relieving properties. Osteoarthritis, this systematic review and meta-analysis of 10 randomized controlled trials on 786 patients found that curcuma longa significantly reduced knee osteoarthritis pain compared to placebo, and was comparable to non-steroidal anti-inflammatory drugs such as ibuprofen in improving joint function, though further research is needed to determine optimal dosage and administration. Anti-inflammatory and antioxidant activity. This systematic review and meta-analysis of 66 randomized controlled trials found that turmeric and curcumin supplementation significantly reduced inflammatory markers, including C-reactive protein, tumor necrosis factor alpha, and interleukin-6, while also enhancing antioxidant activity by increasing total antioxidant capacity, reducing malondialdehyde, and improving superoxide dismutase activity, suggesting its potential as an intervention for improving inflammatory and oxidative balance.
If you're someone that's been trialing different supplements and you're still lacking that energy, spark, drive, and overall vitality, then you may want to check out my brand new supplement that I've just released called Catwa Pure. Catwa Pure harnesses the power of a particular Amazonian herb known as Catwaba bark, which has been used for centuries to boost mood, enhance energy levels, and act as an aphrodisiac. So definitely check out Catwa Pure. You can learn more by visiting inbeforesups.com.
Now, here's a lesser known benefit of turmeric. Due to its poor systemic bioavailability, curcumin from turmeric accumulates in the gastrointestinal tract, where it may directly regulate gut microbiota, potentially explaining its wide-ranging pharmacological effects. Studies suggest that curcumin increases beneficial bacteria like bifidobacteria, lactobacilli, and butyrate-producing bacteria, while reducing pathogenic microbes like Prevotalaceae, Coriobasterales, Enterobacteria, and Enterococci, which may contribute to its beneficial properties. Period pain and premenstrual syndrome. This systematic review and meta-analysis of 5 randomized controlled trials on 379 participants with mean age of 23.33 years found that curcumin supplementation significantly reduced the severity of dysmenorrhea and premenstrual syndrome symptoms, likely due to its anti-inflammatory and antidepressant properties, though further research is needed to determine optimal dosing. This systematic review and meta-analysis of 6 systematic reviews and 16 randomized controlled trials found that curcumin supplementation significantly improved liver enzymes, increased resolution of hepatic steatosis, and improved fasting blood sugar, body mass index, and total cholesterol in metabolic dysfunction-associated fatty liver disease, though further research is needed to assess its effects on liver histology and fibrosis. This randomized, double-blind, placebo-controlled trial in 56 physically healthy adults with major depressive disorder who were allowed to take antidepressants found that curcumin, 500 milligrams twice daily for 8 weeks, significantly improved depressive symptoms compared to placebo between weeks 4 and 8, as measured by the Inventory of Depressive Symptomatology self-rated version, with greater benefits observed in individuals with atypical depression, though larger and longer studies are needed to confirm these findings. So does turmeric only work for unhealthy people? A criticism of many supplements on the market is that their effects are investigated on adults with pre-existing health conditions, as opposed to healthy adults, and as a result, beneficial effects may not carry over to healthy adults. While you may think this is the case for turmeric, however, this randomized controlled trial in 38 healthy middle-aged adults around 40 to 60 years old found that a low dose of lipidated curcumin of 80 mg per day for 4 weeks significantly improved several wellness-related biomarkers, including lowering plasma triglycerides, beta amyloid protein associated with Alzheimer's disease, soluble intercellular adhesion molecule, and alanine aminotransferase, while increasing plasma catalase, nitric oxide, and myeloperoxidase without raising C-reactive protein, suggesting potential health benefits even in healthy individuals. So are there people who should not be using ginger and turmeric? Well, definitely. When it comes to curcumin and turmeric, one point to really pay attention to is the fact that it can actually lower iron levels. It has a chelating effect on iron. So definitely don't want to be using this particular herb around red meat or high iron foods or iron-rich foods. This works well for those who are actually high in iron because it actually helps to lower iron levels. Iron is damaging and problematic when it's in high amounts in the human body because it's very reactive. But if we're looking at ginger may have some potential blood thinning effects, same as turmeric. So if you're using, blood thinners, then you may want to be careful when you're supplementing with them. In terms of final dosages and rough dosage ranges, many studies generally use around 1 to 1.5 grams of ginger daily, and many clinical studies investigating the effects of turmeric and curcumin use a curcumin extract rather than whole turmeric powder, and the typical dosages used in studies are curcumin extract at around 500 to 2,000 milligrams per day, often standardized to 95% curcuminoids, and combined with piperine or black pepper extract in lipid formulations to enhance absorption. So that pretty much wraps up today's video. If you actually did want to check out an advanced form of curcumin, there is one called tetrahydrocurcumin or THC. That's not from cannabis. No, it's tetrahydrocurcumin. That's a more advanced curcumin form that you may want to check out. That's it from me today, guys. Please like the video and leave a comment down below to support the algorithm.